Speaker, and can I say it is a bit of a novelty getting to speak on a health bill, as the Minister said, 18 months into the term of this government, and finally we actually have a piece of health legislation before the House. But as the Minister said, that is not to say that there hasn't been things happening in the health sector, and he took some time to discuss what he thought was happening out there in the health sector, and I intend to follow his lead, Mr. Speaker, and talk about, well, the perception of what's happening in the health sector, I suppose, in particular from my electorate. The cuts, or changes, as the Minister likes to euphemistically call them, the cuts that have been occurring at mid-central DHB in particular have been extensive and varied, and they have all come about because the Minister wandered up to Palmerston North, read the Riot Act to the District Health Board, and then wandered back to Wellington to leave them to it. So it is good to finally see the Minister perhaps taking some accountability for his efforts. But what is happening at Mid-Central District Health Board? Well, as Ruth Dyson said, probably the biggest and most significant cut is that to district nursing services. And what we're seeing here is a cut of the overnight service, which is particularly important to those who are most vulnerable, those who are receiving palliative care from our district nursing staff, those wonderful nurses who will respond to any call out in the middle of the night, will go and deal with someone in their home so that that person doesn't have to go through the discomfort, the agony, the trouble of having to go all the way into hospital and being admitted. And what's going to happen is that people don't want to see that service disappear. So instead of the DHB taking responsibility for it, the core government responsibility, it is going to have to be shifted to the hospice, a hospice which is already stretched, a hospice which welcomed the additional funding that this government promised and this government did actually give them. But of course it didn't say, oh, and by the way, you're going to have to fund a whole extra service with that money. The hospice thought that was a kindly gesture to help them balance the books and to help them maintain their current services. But no, it wasn't that at all. Actually, it was a little sweetener before they got hit with the information that they were going to have to provide another service. Another thing which is going is the Diabetes Lifestyle Centre, and that along with sexual health services. And that's about right for this government because they seem to have no interest whatsoever in public health and health promotion. These are two facilities which actually help to keep our population well, so that you don't end up having to go into hospital. But this government seems to have no interest whatsoever in keeping people well. What it wants to do is see you arrive in hospital, get an acute admission so that it's easy to measure, easy to tick the box to say that you've been through hospital. Rehabilitation services, they're going to be cut as well in Palmerston North, as are the assessment, treatment and rehabilitation services in the Horowhenua. So yes, the Minister is absolutely right. There is a lot going on. There has been a lot going on in the health sector. Even though this is the first bill that we have seen before the House, there has been a lot going on in our health sector in New Zealand, and none of it is good, and it's all about cuts to frontline services. And I suppose this is where we have to call into question the accountability of the Minister. And he refers, the bill actually refers a lot to the accountability of the district health boards. But what about the accountability of the Minister? And he has studiously avoided any requirement to be accountable. Nothing going through the House. So we as MPs don't get to scrutinise his work. It never goes to select committee, so the public don't get to scrutinise his work. And everything, all the difficult decisions, all the bad news passed off to the district health boards. And that's probably why we saw 500 people in Levin attend the Mid-Central DHB meeting this week, because those 500 people wanted to go along to the District Health Board, the people who they see as making the decisions, 500 people, the people they see as making the decisions, they wanted to go and plead their case to the DHB. Why? Because the Minister isn't listening. He does not accept the responsibility for his actions, and he would rather pass it off onto other people. But the Minister does have responsibility, because before the election, the National Party made two promises in particular. Two promises to do with healthcare. One was more frontline services. Well, we've seen so many cuts to frontline services, it's not funny. And the second, of course, was less bureaucracy. Well, what have we seen? We've seen the establishment of a National Health Board, and now we are seeing the establishment of the Health Quality and Safety Commission. Two more layers of bureaucracy, flying directly in the face of the promises made by the National Party before this government. Two more broken promises to add to all the other broken promises that we've seen from this government. And so it's, so that setting up of the HQSC is one part of the bill. The other part is, of course, including amendments to support the provision of shared administrative support procurement services across the public health system. And listening to Dr. Paul Hutchison and to the Minister, you would imagine that this is something that they just dreamed up all by themselves, that wasn't happening in any way whatsoever before the national government came in. And this is part of the mythology that this national government is trying to create about the previous Labour government, that it was overloaded with bureaucracy and had no interest in effective outcomes and indeed in shared services. Well, look, we have already seen down in Southland and Otago those two DHBs reach a point where they are in merger. Now, that didn't just happen overnight. Collaboration between those two district health boards was happening long before this National Party came into government. It hasn't all just suddenly happened since Tony Ryle became the Minister. It is an utter myth to say that there wasn't collaboration between district health boards before this government came into power. Indeed, again, in my own area, in the Lower North Island, there is an awful lot of regional collaboration between Wairarapa, between Hutt Valley, Capital Coast and Mid-Central district health boards, and all the way up to Whanganui, Taranaki and Hawke's Bay. They do an awful lot of collaboration, and they have been for some time. In fact, Wanganui and Mid-Central entered into an alliance. Perhaps the first step towards merger. We don't know. That may or may not be the best thing for those two DHBs. What we would like to see is more coming from the clinicians and from the public there to tell us what they think about whether or not this is the right path for them. But it is an utter myth. Completely, and Dr. Hutchison attempted to reinforce this myth, that collaboration wasn't happening before the national government came into power. And so, yes, this bill does extend it and perhaps brings it more into a more formal structure. And I look forward to the opportunity to discuss this at Health Select Committee, because it's about time that we had public discussion about what this government is doing. But make no bones about it. What a lot of this bill is about is coercing the district health boards into amalgamation, because another one of the myths is that 21 DHBs is too many. Well, if it is too many, how many is enough? What is the right number? If this government thinks that the Labour government brought in 21 DHBs and that was too many, how many is enough? We haven't heard from this government how many they think is the right number of DHBs. But what we are seeing through this bill and other measures is a coercion of DHBs and PHOs, much more strongly amongst PHOs. Just cut the funding. If you want a PHO to merge, according to this minister, you just cut their funding off. Perhaps it's a little bit more subtle with the district health boards, but that is the direction that this minister wants to go in. Well, I say that is wrong. Our communities, our clinicians, they should have the say over the direction that our district health boards go in, and if they think that they would benefit out of closer relationships with their other DHBs or going as far as merger, then that's fine. But as we've already seen from Southland and Otago, if you don't get the consultation right, then you will get a backlash from the clinicians, you will get a backlash from the public. Mr. Speaker, I am very pleased to see this bill going to the Select Committee. It is about time we got some public scrutiny of what this government is doing in health, and I hope that we see many submissions from all the people who have expressed their concern to me and to other MPs on this side about the disastrous direction this government is taking our health sector.